Thank you for coming back for the next video. I'm sorry we had to cut off in the middle of such a hardcore topic. We are discussing sexual child abuse and how violent and dangerous it is. The three categories of it, again, are physical, non-physical, and violent. And our job is to anticipate and hopefully prevent it, and certainly then provide every care for that child should they have been harmed. Signs and symptoms of sexual abuse are injury to the genitals, sexually transmitted diseases, repeated UTIs, bedwetting that they didn't have before, hypersexual behavior or hypersexual curiosity from a child, discomfort or shying away when someone hugs them or there's any kind of physical contact, and avoiding being wherever the abuser is. So if it's a parent or a family member, they don't want to be at home. They might not tell you, I don't want to go home, I'm being abused. They'll tell you they don't want to go home because, I don't know, it's cold there, or there's not enough food, or something silly, when there might be something far more traumatic. So we have to keep our eyes open. Again, we're mandated reporters, and we need to be the eyes and ears and advocates for these horribly wounded children. Neglect, there are three different categories: physical, educational, and psychological. Physical means, of course, no food. We're not meeting their activities of their needs of daily living. So food, water, shelter, warmth, cleanliness. Educational needs, we're not sending them to school because maybe the parents are drug addicts and just can't get themselves out of bed to send the child to school. And then there's psychological neglect, where you're not meeting their needs. Children need to know that they're loved, that they're appreciated, and perhaps they're not being told that they're horrible or, verbally abused, but if they're not being loved, that is psychological neglect. There are huge differences, and we'll talk about this in SIM too, between child abuse and neglect, and then what's called non-organic failure to thrive versus organic failure to thrive. So non-organic failure to thrive is there's not anything physically, or wasn't anything physically wrong with the child, but they were not provided food, they were not provided all of the needs that they have, and so they fail to thrive. Children in orphanages in Russia or the Ukraine, they're fed, they're toileted or diapered, but they're left in cribs, and because of that, a normal infant toddler should be walking by somewhere around a year. That child might be 2 or 2.5 before they walk. Their speech is delayed because there's no one talking to them, so they're not talking back. And all of these are signs of non-organic failure to thrive. So that means there's not an illness causing it. It means there's something that's not natural that's causing the failure to thrive. On the next slide, we talk about our mandated reporting needs. And as you know, you're already mandated reporters. You can and should report anything that seems suspicious to you. It does not have to be a proven case of neglect or abuse. You just have to have that feeling. And as a nurse, you're going to learn, if you haven't learned already, which you've been in clinical now long enough to know, that you can trust your gut instinct. You might not know exactly what's wrong, whether it's a child, an adult, whatever it is, but you know there's something wrong. So don't ever hesitate to report an incident. You might save a life. If you don't already have this phone number in your phone, you should. It's the PA Child Line, and then there's a national child abuse line that you can call, and they will take the information, they'll take your name, they'll keep your name private, and they will follow up on whatever's going on with that child. Mandated reporting has saved a lot of lives. So if you have the slightest question, report it. So When a child comes in, you want to make sure that you document everything you can that's specific to that child without putting in your opinion. This is extremely important. They will not develop patterns that can be used to take a child from a home if nobody documented it. So, of course, a child is admitted to the ER, broken arm number 3. So, of course, you're going to document the time, the date. What did the child say? What happened? Where is the break? What does the child look like? All of that stuff that I would consider to be essential. Head to toe assessment. You want to put factual information. Child presented with a spiral fracture of the left arm. Upon reading previous record, child had a spiral fracture of the right arm 6 months ago. Child has a bruising on their left flank and on their right lower leg. And then you say, child stated, fell down the steps, blah, 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 whatever the child states. Parent stated. Okay, you have to put the facts. Who knows if the parent's telling the truth, but what you have to do is put what they say, and you can't put your opinions. You can't say, that dad looks really shady, and he kept shutting up the mom, so I know they were abused. It may be a cultural thing. Maybe maybe he's just so stressed at being at the hospital. You don't know. But what you document has to be the facts. It will come out in court. You can't put, this guy's been here before. I know he's bad. You can't, that's an opinion, and you can't put that. And your facts have to be accurate. They have to be backed up by what the medical record says, what the x-rays say. Again, if you're stating what the family member said, you can state, mom said, and put in quotes. She fell down the steps. It's even better if it is documented by 2 people. And these things can be used in court. And depending on the severity and what's actually going on, that child may be removed from the home until an investigation can take place. Once child abuse or neglect has been suspected, then our role continues, and then we become the advocate, sometimes for the child, sometimes for maybe the child and the mother. It just depends on the situation, but certainly let's focus on the child. You're going to evaluate both the child and family. A lot of times abuse can be prevented with teaching and counseling. And yes, some children are successfully returned to their home after the parents have been properly educated. There's also, what I've already mentioned many times, anticipatory guidance. What can we do to make sure abuse doesn't happen? And especially in like a newborn, postpartum, sleep deprivation sort of thing. What can we do to help the parents find someone to help them care for the child? What can we do as we teach them, a 3-year-old is going to defy you. A 3-year-old is going to defy you all the time. What can we do to help those parents so that doesn't happen again? Remember, as we're evaluating the child and the family, we have to make sure that we do not judge the situation. We have to believe the child. That's our job. We might be the only person believing the child, and then we have to investigate it accordingly. We cannot judge the family because you don't know what happened. Here is a slide that shows some things that aren't abuse even though they look like it. There are a couple of practices that are becoming more and more accepted for holistic healing. One is called cupping and coining. This is a child who's been coined. This is not abuse. What they do is they take a coin about the size of a quarter, and they rub it on the child away from the lymph nodes towards the chest and out. The thinking is they're then moving poison away um, from the lungs, they're moving poison away from the brain, and they're protecting the child. The other one is cupping. Athletes are doing a lot of cupping now. There might be some of you that have found this to be helpful. And the premise with cupping is that it stimulates the blood cells, gets the muscles moving in different ways, and therefore makes life more, or makes that muscle group stronger and more effective. When you see cupping and coining, it is very important that you investigate it with the family. What are these marks from? And then you have to talk to them about whether these methods truly help. Do they hurt the child? But you have to be careful that you not accuse them of child abuse because it is a cultural practice. Another thing that you might see I don't have a picture of it, but in biracial children, there is a phenomenon called Mongolian spots, and they sort of look like right here if you look on this child, or even to some extent like right here, but basically they're discolorations of the skin that is just a mix of pigmentation, but it truly looks like bruises. So you have to be really careful when you see a child with Mongolian spots that you recognize what they are, and don't accuse the parent of abuse. There's a child abuse case study in your clinical packet. We will review this in class, but if you want to go over it on your own, that would give you a heads up in the classroom environment. Now we're going to talk about a child in the hospital. So when a child is hospitalized, and let's be honest, when any of us are hospitalized, it's traumatic and disturbing, and it's not the plan for how our day was going to go. And even the simple things, an appendectomy, broken leg. Right now, at least at WellSpan, it is completely packed with RSV cases, both in children and adults. When your child's not breathing right, it's pretty scary. So not only is it scary to the child, but it's scary to the parents too. So we have to make sure that we're meeting all of the needs of the family. We got to keep the child safe. We have to make sure when a child is separated from their parents, that's very, very traumatic. So in most hospital situations now, there's not a reason to separate the child from the parents, except if they're doing some sort of procedure. Both the child, if they're going to be separated, and the parent need to be prepared for when that separation is going to occur, how long it's going to be, and of course we want it to be as limited as it possibly can be. Some common themes to keep in mind: never lie to a child or a parent. Don't tell a child something's not going to hurt, because it does. Shots hurt. Setting a broken leg hurts. Having surgery hurts. So you have to tell them it's going to hurt, but then afterwards you're going to feel better because we're going to make you feel better from what you do. You have to allow the child choices where choices can be made. Now, if they're NPO, you can't give them a choice of what to drink. But let's say they are on clear fluids. Well, what difference does it make if they drink ginger ale or, I don't know, Kool-Aid? It doesn't make a difference as long as you can see through it. So we want to give them choices that we can, and then we can't be overridden by the child either. So we have to set very reasonable and consistent limits. And that is all about safety for the child. When an infant is hospitalized, of course, safety is paramount. You're never going to leave the side of the crib rails down for the child. We're going to move on to this next slide in the next video. So stay tuned.